spine flexes, the sacrum extends. It's opposite. That extension we call counter-nutation. Nutation is when the sacrum goes forward. It nods. So here when the lumbar spine flexes, the sacrum counter-nutates or extends, and then it has no choice but it gets pulled, just like the train. It gets pulled along, and then it will recruit the two innominate bones. So there should be a little bit of lag time between the time the sacrum moves and the innominates move. If on one side, however, we find that there is no lag time, that it moves more quickly than the other side, that tells us that even though it's moving first, and usually further at the end of the range, it's usually higher, that is, I know it's counterintuitive, but that is the hypomobile side. It's because it's stuck. It's because it's fixed to the sacrum that it moves further. It moves first and or further. So the thing that's hard to get your head around is that it's restricted, but yet it moves further. How could that be? It's like an oxymoron, right? Is that your question? But you got to think this through. There should be a little laxity in the joint, but when it's stuck in what we call, in different terms, a positional fall, or a subluxation, or a malalignment, there's no slack in the joint. There's no more play. It gets recruited earlier, and it goes further. So that's what you have to try to understand eventually. That gives you the side. Your landmarks tell you there is in fact something wrong, but these mobility tests, especially this one, tells you the side, and then the Stork test identifies the actual quadrant, so to speak. Is it upper right, lower right, upper left, lower left? Let me get more specific. In our treatment, when we do muscle energy, we're not going to be super specific. We'll treat a side, but we get into our manual, our mode manipulations, we get more specific, and we treat a compartment. Upper, lower, upper, lower.
I'm trying to figure out how you're saying it's upper, like on the right side, the right side, and then you have the upper and the lower. If it's just the sacrum and it's just the ilium, how does the upper right and the lower move independently of each other? Like you're saying that like the upper will be hyper while the lower is hypo. How does the two bones, how is it moving independently?
There is a bevel we'll talk about in the middle of the joint, and it provides an axis or a fulcrum. So you get one compartment moving above the bevel and another moving below it. So that's part of it as well. But it's the orientation. You have this L shape. You do have the ability to move more in one compartment than the other. You don't have a situation where one totally moves and one totally doesn't move, but you do have a situation where one moves more than the other. They should move equally, as far as we can tell. What would be comparable to that? Sort of like the elbow in a sense. You have the radiohumeral joint, and you have the proximal radial ulnar joint. One bone, but it has two articulations. Top of the sacrum, bottom of the sacrum, it's not exactly the same. It's one bone, but you do have this sense of, and you feel it. You can tell very often when you clinically assess that one is moving well and one isn't. A lot of it's theoretical. So I'll give that some more thought. All right, so let's practice the standing flexion test, which we've already done.